Court, of course, changed some of our excitement because they said that Medicaid expansion could no longer be forced by the Affordable Care Act. Now Medicaid expansion would be a state-by-state decision. That's the same Supreme Court decision that upheld the mandate that everybody buy insurance. Okay, they also said now it's a state-by-state decision. So the first thing that this legislature did this year, or actually last year, at the beginning of the year, was to pass a law that said, number one, it's the legislature alone decides whether we expand Medicaid. So in other words, they didn't want the governor to run off and expand Medicaid without them, which has happened in some states. The governors have forced expansion. And then the second thing it did was it said, we're not going to participate in reform at all. So North Carolina, before, at the end of 2012, actually got a $74 million grant and it didn't have any requirements on us as a state. All it did was $74 million to hire 500 people across the state to go out in communities like Hickory and surrounding counties and tell people about reform and get them enrolled in insurance. And then the other piece of that money, that $74 million, was going to get our IT system up to date, because we have seen serious problems with that lately. And then it was also going to set up a toll-free hotline in North Carolina where you could call and get answers to questions about the Affordable Care Act. The same law that rejected Medicaid expansion sent that $74 million back to Washington. So that's why it's been sort of a scramble to get people enrolled. That's why people like me and others are going around the state trying to tell people about reform, because we didn't get that $74 million to hire 500 people to do it. So that's sort of, I like to bring that into it because it puts the whole decision in context, that it has nothing to do with policy, it was really politics. Because that makes absolutely no policy decision. Even if you think you can make a policy argument for no Medicaid expansion, there is no argument for sending the $74 million back. That doesn't reduce the deficit at all. All it does is send $74 million to another state.
That's right.
I'll just touch on two things because we want to, have everybody. I think most people in here know a lot of the devastating consequences of not expanding Medicaid, the 500,000 people. I just want to bring your attention to a couple things. You know that it's very devastating for hospitals financially. We've seen layoffs already. And a lot of those jobs, the analysis has shown that a lot of those jobs would have been saved if we had Medicaid expansion at those hospitals that are doing layoffs. Okay, but two recent things came out that might be sort of updated, and I can send it out to the whole group if we have that capacity. One is a new study by Health Affairs, which is sort of a public policy journal in the healthcare world. And it talked about the consequences of each state for not expanding Medicaid. And it had interesting numbers. In North Carolina, it said that you would have about, if we expanded Medicaid, you would have about 45,500 fewer cases of depression diagnosed in the state every year. You would have 27,000 more diabetics getting the insulin and other things they need to live. You would have 27,000 more diabetics having access to those drugs and devices. You would have 12,000 more women getting mammograms every year. 12,000 more if we expanded Medicaid. You would have 27,000 more Pap smears. And we would have 14,000 fewer catastrophic medical bills going to people. So people going into bankruptcy, 14,000 fewer people going into bankruptcy and foreclosure because of medical bills, if we had expanded Medicaid. And then at least 1,145 fewer deaths if we expanded Medicaid.
How many more deaths?
How many?
1,145. And I can talk about some of the different discrepancies in the number you've heard, but that's one of them. So then the other piece is a new Jackson Hewitt tax analysis that says that, and we can talk about the details of this too, but because we didn't expand Medicaid, next year we can expect North Carolina businesses to pay between $80 and $120 million more in fines than they would have paid if we had expanded Medicaid. So those are important numbers for you to have as you're talking about this issue. And the final point I'll make is that we can change the decision to expand Medicaid anytime. That was not a one-time decision. So we have to continue to advocate for it. We lose a lot of federal money every year we don't expand. There are more than 1,000 deaths every year we don't expand, but it's not a final decision. Every year we have the opportunity again to expand. Thank you.
What was that last statistic you gave?
So it was businesses in North Carolina collectively will pay about 80 million to 120 million more in fines because we did not expand Medicaid. Because certain large employers have to provide insurance, but the fine is tied to whether or not their employees have health coverage. It doesn't have to be coverage provided by the employer. If they're getting it somewhere else, that's fine. So if those employees are getting Medicaid, that's fine. Then the employer has met his or her obligation. So there's a lot of employers who don't provide coverage, and their employees would get Medicaid if you expanded, but they're not because we didn't. And so they'll have to pay $100 million in fines.
Could you clarify something? I have heard that the New England Journal of Medicine estimated 2,800.
Yeah. Yes, and I gave that number to Reverend Barber when he said that earlier. So, and in the study of the New England Journal of Medicine. The New England Journal of Medicine basically did an analysis of states that had expanded Medicaid versus states that hadn't in the past had Medicaid expansion. And they estimated that every time you expand Medicaid by about 500,000 people, there's an associated drop in the number of deaths by about almost 3,000 people. And so this study basically looked more specifically and used a different analysis. It used a Kaiser analysis, and it said that this gets a little complicated, but I think you can say between 1,000 and 3,000 people. But basically, Kaiser thinks that if we don't expand Medicaid, you would have basically 300,000 people in North Carolina who would have no options for health insurance. Whereas there would be a couple 100,000 of those people who would now get private coverage. They get Medicaid if we expand it, but they'll get private coverage if we don't. And so the expansion, it's not really 500,000 people we're leaving out. It's like 300,000 people. So it's a fewer number of associated deaths.
Still a lot.
We can get into more details if that's too confusing. But anyway, I just wanted to give you those numbers for where we are right now.
Thank you. Colleen.
Hello. Just
Yeah.
My name is Colleen Anderson. I am the Director of Healthcare Services at the Community Health Center of Catawba County, which is a program of Greater Hickory Cooperative Christian Ministry. So a lot of folks know us as CCM, the Christian Clinic, various things, but we are, as of January 1, the Community Health Center of Catawba County. Our goal is to provide a little bit of gap coverage because North Carolina cannot expand Medicaid, and because we do have quite a few uninsured folks in the county. So we exist to offer primary, specialty, and dental care and pharmacy for those folks who do not get coverage through their employer, don't qualify for Medicaid, and don't have any other options for insurance coverage. So those numbers are staggering. Our goal on the flip side of that is to prevent some of that by providing that primary care and specialty care, providing that medication to those diabetic folks, to prevent them going to the ER, prevent those catastrophic hospital admissions. And we do a lot of chronic disease management, but we also see folks last minute, sick appointments, just like any other physician office, so that we can prevent ER visits for a sinus infection or an ear infection. We have a huge network of physicians that either volunteer at the clinic or take our referrals and see our patients pro bono in their offices, which is wonderful. And we also have dentists that come in to see dental care. That being said, we would certainly have a lot of our folks that would qualify for Medicaid if it were expanded. We're in a situation right now, we don't know if or when that's going to happen, so we have just kind of prepared. We have seen an increase. There have been multiple factors going on at the same time, and so we don't have any rock-solid statistics. I'm a poli-sci major before I was a nurse, and I love statistics, but I don't have any rock-solid statistics as far as whether that increase is due to the Medicaid not being expanded, whether it's due to our increased marketing. We went, in July, we received a grant. We now have a full-time nurse practitioner and are pretty much open double the amount of hours we were in the first half of the year. So we've got a lot of things going on at our place that, so we're not quite sure how it's impacted us. We are really focusing on the population in the county that would have now had Medicaid if we had expanded. We're doing a lot of marketing to those populations, working with a lot of churches to try to get the word out. But the National Association of Free Clinics did estimate about a 30% increase in need for free and charitable clinics in the states where they did not accept Medicaid expansion. So, and that's pretty close to the increase we've seen. So we are seeing about 30 to 35 patients a day coming in for medication. We are doing a lot of diabetes management, a lot of heart disease, and just trying to keep these folks healthy to prevent as much as we can on the tail end with the structure not being in place in our state for Medicaid.
Someone said that, that the MAC program is no longer in effect, and also that it's no longer free services at CCM. I don't know if that's true.
The MAC program, a little bit of background, I'll try to be as brief as I can. The MAC program is called Medical Access for Catawba County. About 8 years ago, we had a huge problem at CCM because our clinic was only open about 10 hours a week. So we had to make a decision at that point whether we could do chronic disease management or whether we could treat folks that are coming in with acute illnesses, because we had way more people needing our services than we had time to give it with only being open about 10 hours a week. So we wrote a grant and were able to create the MAC program, which was a network of primary physicians in the county who agreed to see X number of patients pro bono in their offices and manage their chronic diseases so that the clinic could then focus on the acute care folks and being seen. And then the specialists that came in to volunteer at CCM or the ones who were in our referral network, then those MAC patients would kind of use that same system to see the specialists that our patients who were being seen in the clinic would see. So fast forward to in the past 6 months, we now have a full-time nurse practitioner, we have full-time staff, we're open 35 hours a week, and the MAC providers were tapering off and not seeing as many patients. We now have the capacity to see those chronic disease patients. We had one provider, there was continuity of care, and so we folded those MAC patients into our general clinic population because we now had the capacity to see them that we didn't before. So now we have the capacity, because of staffing and hours, to see the chronic disease patients as much as they need to be seen, as well as the acute care that needs to be done. We keep about 3 to 4 appointments open every day. So if someone calls up and says they think they have a sinus infection, we are able to see them that day. We've developed a fast track system with both hospitals. All of the case managers have been educated. They all have my phone number. If they identify someone who is hospitalized, who does not have a primary care physician and does not have insurance, they're fast tracked into our system. So they have a month to get their information to us, but typically we see them 1 to 2 days after discharge. And both hospitals have discharged several patients with a bus pass and sent them straight to us. They get their medicine that day, they get seen by our provider. If they've never been to our clinic before, then they get established as a patient that day, in hopes that if they do have something go on after admission, instead of going back to the hospital through the ER, they'll give us a call, and it's typically something that can be prevented if they're able to see us instead of going back to the hospital through the ER. Speaking to the fees really quick, and then I'll take another question. We have provided our services completely free of charge for the past 10 years. And we have been in a really bad financial crisis for about a year. Our clinic and pharmacy cost about $600,000 a year to operate. So There's a lot of clinics in the state have had to look at this and look at this issue. We were very fortunate that we were able to not have to look at this issue for a long time. But we have transitioned to being a charitable clinic. We request a $5 donation from the patients when they see the provider, and we request $2 per prescription in the pharmacy. If they cannot meet that requirement, they are welcome to meet with me. I have patient appointments blocked out to meet with me. We discuss it. It may be that they can pay the $5, but they don't have enough to pay for the prescriptions. No one is turned away or not given care because of that inability to pay. But it does provide some little bit of income to supplement. It's less than 10%. If they all paid, it would still be less than 10%. But there are a lot of studies out there now too that show that patient compliance increases, and when they have to kind of pay a little bit for their care, their accountability goes up, and they have a little bit of ownership in that, and so that actually has improved a lot of patient outcomes in areas. So,
You answered part of my question, but I know that your situation and your financial, because my church participates pretty much in your own station. But did it affect you when the government shut down? Did it affect your ability to function?
no, because we don't get any federal or state funding.
We're
We're a 501c3 not-for-profit, and we don't get any funding from any state or federal agencies. Yeah, you have a follow-up?
Since Medicaid has that same model where people have to live it for prescriptions and doctor visits, that same idea, is your board in support of expanding Medicaid? Is the CCM board in support of expanding Medicaid in our state?
That would be a great question to ask them. Yeah,
I would like to know the answer to that too.
okay. Well, Dr. Daniel Hatcher is our board president, and I would welcome you to contact him about that. I don't know.
Can I make a comment about that? That might help answer the question. Our church, Exodus Church, founded a housing program called Exodus Homes, which serves homeless people returning back to the community from treatment centers and prison. And all of our residents go. All of our residents go to CCM. It's a godsend. I don't know what we would do for our men and women coming back to this community from treatment centers and prison who are homeless, have nothing, and are starting over again. They all go to CCM. They all get the card. Most of them have chronic health problems. They go to the pharmacy. And when you were having, your financial, crisis, everyone like us was in a crisis, because what will happen if CCM goes out of business? We had an Affordable Care Act workshop where many of our working poor residents who make $7.40 an hour, they work 27 hours a week. A lot of them working poor in this county don't work full time, y'all know, and they don't make more than $7.40 an hour, sometimes $8 an hour. They were so disappointed to find that they don't meet the income requirement for the Affordable Care Act. And so they were locked out of the Affordable Care Act. They couldn't even apply to get the subsidy. And so then that makes them right back on your doorstep. If Medicaid had been expanded and our folks had been able to get that would have taken a tremendous load off of you. I would hope that your board would support that.
Yeah, we do too.
Yes, my name is Tony Woods, and I've organized several Affordable Care Act conferences across Catawba County. And one of the questions that I have is that I've noticed in my conferences that some of the people are coming from surrounding counties, such as Lincoln County. I've also held them in Cleveland County. And I wanted to know if your community health center would allow people who are residents outside of Catawba County to come and get services there as well. We've had quite a few. We've been able to register over 100 people. However, we've also had quite a few who fell into that gap. And I do the best that I can to find measures to meet their needs as well. So do they have to be residents of Catawba County?
To see our clinic, yes. There is a website, it's ncfreeclinics.org, which is the North Carolina Association for Free Clinics. And there, with the exception of Alexander County, every county in our region has a free or charitable clinic that covers them. So if someone's from Cleveland County, then you can go on that website and you can get them the contact information for the clinic that's in Cleveland County. And then you can call. And I will, little disclaimer, every different organization has their own requirements. They're fairly similar, but they're pretty geographically based, and as is ours. There is a clinic that serves parts of Alexander County, but that is the only county around here that doesn't really have any coverage. We've discussed possibly expanding into Alexander County, but right now we're pretty full with Catawba County. So I'm not sure how we would handle that. So, you know, and going back to the Medicaid question, I think everyone that is involved with CCM is supportive of the mission, and certainly expanding Medicaid serves that mission. Our goal is to keep people healthy, but like I said, we don't have any official statement on it, and Dr. Petra would be the contact for that.
We're going to go ahead, we're going to go ahead and move to Dr. Sims, and then we're going to then open it up to questions for all of our panelists. So thank you, and Dr. Sims.
I don't know how much I can add. I'm a former healthcare provider, now chaplain. But one of the things that struck me is that in rejecting Medicaid expansion, at least a half million people will not have coverage. In North Carolina, Medicaid program cost $14 billion last year, of which the state paid $3 billion. The rest was by the federal government. And if the expansion was in play, the feds would pay 90% of the cost for the next 3 years. So
100% for 3 years. 100% for the next 3 years.
it might be and then 90% after that.
Correct.
So it doesn't make sense, medical-wise, not to expand. And like Dr. Barber said, this was a political decision. And because of that, a lot of these rural hospitals have gone out of business because they can't sustain it if they don't have income. You know, we used to have a community hospital in Vanderbilt. It's gone. A lot of folks can't find providers because the reimbursement is low. And you have to understand a lot of these physicians trying to pay off medical bills. I was kind of lucky in that I adhered to the text that Dr. Barber did in Matthew 25. What you do to the least of these. And it was my practice never to ask what kind of insurance anyone had. Just send it, and I would take care of it.
Good for you.
Tell them what kind of doctor you are.
I'm a neurosurgeon.
Yeah.
And I can remember I had a young gentleman who was HIV positive. He had a blood clot on his brain, and nobody wanted to treat him. And I said, just send him to the office. And, you know, I treated him. And and he said, thank you. I said, that's my job. That's what I'm here for, is to take care of you if you're sick. And I worry about God reimbursing me later.
Amen. Amen.
To get this Medicaid expanded, because the least of these, it's costing us money in the long run, and it's going to cost us more money. If we get people healthy, then they can be able to work for themselves, get their own insurance, and then everybody's better off. When we raise the standard of living for everyone, all of us are better off. It costs less. And I think we need to do so.
Well, thank you to our panelists, and now we're going to move to questions. So if you have questions for Adam, Colleen, or Dr. Sims, you can go ahead and address them, and then I'll come to you with the mic so everyone can hear it.
Colleen, I would like you to address something that I hear a lot. I lost a son because he was denied medical care because he couldn't get insurance because a birth defect is a pre-existing condition. Now, people who want to argue with me that there must have been some way to save his life, there wasn't. But their argument is that we should let charities take care of this. Tell me, explain what kind of a burden that would be and whether if it would even be possible for charity to take care of the needy. And Doctor, if you would address it as well.
You have to, as far as charity taking care, you have to have a physician who says, I will bear the brunt of taking care of those who have no insurance. You can't force someone to do that, but that's a decision each physician has to make. Charities can't do it all because they're dependent on people to give them money. And if you don't support them, they can only do so much. Now, in my spare time, which I don't have a whole lot of, I'm a volunteer with the Red Cross. I'm captain of the disaster team, which means at night, if your house gets on fire, I get out of bed and I go tend to your needs, and then I have to go to work the next day. But it's all driven by volunteers. If I don't give my time and other people don't give their time, Red Cross can't function. If you don't give your money or your time, CCM can't function. So we're all interdependent. No man or woman is an island. We have to support one another because we're all in the body of God. And if we believe that, then we need to act on that.
I'll just tie up to that. That was a great response. We definitely are limited by the willingness of the volunteers. Part of why we had to seek grant funding for a full-time provider was because we weren't able to do it with volunteers alone. We love our volunteers. We appreciate all of them. There's absolutely no way we would have what we have without them. But we needed a little bit of continuity with the providers as well. And charities are, of course, limited to what we can do. But we do our best, and you know, it is very reliant upon the community to be supported financially, with time and talents as well. But we're maintaining and we're able to do it, but certainly there's always room for a little bit more help.
I have a question now. There's need some help on how to make a response to a question that's often asked me by those who are opposed to the expansion of the Affordable Care Act and the other resources across the state. I have some friends who work at a supermarket, and they're constantly telling me that certain families come in and they have $300, $400, $500 worth of food stamps, and they drive off in a brand new car. And they ask me, they said, what the hell is that all about? And I said, well, and here's my response, and you help me out. I say, you know, there's people who take advantage of the situation at all levels of our society. It just so happens that more people kind of notice the people at the lower end that do take advantage of it. Maybe they are, might be aren't. I don't know. I don't really know the circumstances. But there's certainly a whole lot of corporate things going on in this country. Take a whole lot of advantage and a whole lot more money than we can ever realize. But we never hear
anything about that.
So help me, am I making an appropriate response? Because it's a question that I often hear from a lot of my Republican relatives. Sometimes have to be around where I'm doing
Well, there are people who will take advantage of any situation. That's, I don't want to say across the board, but that's just the way some people are. Whether you look at the government, and you look how the government is paying some of these folks thousands of dollars, and they don't have the credentials to make that salary. But no one says anything about that. You know, we still have to help one another. And one of the things that bites me is we're supposed to be living in the Bible Belt. Don't get me started. If we are, I want to know what Bible they're using. Because it's not the Bible of love. It's not the Bible of taking care of the least of these. It's not the Bible of we're all one another. We are created from one. We're all the same under our skin. I just don't understand that. I mean, you have somebody who's going to take advantage of it. I mean, if you have children, they take advantage of it. When they go off to college, they spend a lot of your money. But that's what love is about. Love says, you have a need, I have the means to meet it. I don't expect anything in return, not a thank you, not a pat on the back, but I meet your need because that's what Jesus said. And that's what drives me.
I'll just add to that. I mean, if we're talking, first of all, I think a lot of these stories are made up.
Amen.
You know.
Yeah. Amen.
But there's nothing you can do to convince somebody that it's not true. So, but what you can say, I think, is first of all, I mean, the Affordable Care Act, for example, makes unprecedented investments in fighting Medicaid fraud. And the Obama administration has recovered unprecedented amounts of money in fighting Medicaid fraud. So that's a piece of it. But there's this larger policy question of, let's say someone's taking advantage of Medicaid. Let's say there's 100 people, 1,000 people taking advantage of Medicaid. Is it worth putting hospitals out of business so that we can hurt that, so we can deny those 1,000 people Medicaid? If there are a few people taking advantage of the system, is it worth killing 1,000 to 3,000 people a year so that we can crack down on that Medicaid fraud or make sure that some extra people aren't taking advantage of the system? Is it worth sending all of our tax money to other states so that they get the coverage for the people who need it? It just doesn't make sense. If you think about the amount of harm we're doing to the state, just so that we can say we're making sure a couple thousand people aren't taking advantage of the system.
I want to make a brief comment. We run a food ministry out of our church, and there's several groups of people that come there and help load up grocery carts and roll them down the hill, put them in the trunks of people's cars so they can have food. And the question about how do you make sense out of people who have food stamps and yet are driving a nice vehicle, I think is a question that really needs to be given serious consideration. And I think one of the ways that I've answered that question for myself is, number one, you don't know who owns the car. The other thing is that I visited a lot of these people's homes, and I think that sometimes we don't understand enough about generational poverty. And so you may go to a home where the house is in really bad repair, but they may have a nice vehicle. And that may not make sense to some people. But I think that somehow we have this misguided notion that, that everyone who suffers from poverty or that everyone who gets food stamps, they shouldn't smoke cigarettes like the rest of the rich people, or they shouldn't be able to do. We expect them to give up things, that we're not willing to give up.
That's right.
So I think his question is one that needs, I think we need to learn how to answer that question. Thank you.
I think you're on something that generational problem. People don't understand it. and you don't understand what drives them. I can remember when I was in Vietnam, I bought a tape recorder. And I was taping songs, and as soon as the song ended, I'd stop the tape. Then I'd start another one, because I'm gonna save all this tape. And that came from pride. And I'm sitting there saying, what am I doing? I mean, I got all this tape, and I'm worried about this a little bit. So that's real. That generational poverty is real. And you need to understand, unless you live in somebody's shoes, you don't know.
Amen.
So thank you for the comment.
Amen.
I've got a, I'm not sure, but it seems to me probably there's some restriction on grocery stores that you can take only so many food stamps dollars from one person. I don't know. But if we get some email responses from this group, maybe we could find the answer to that. I would imagine it's and also, I think sometimes people get in such jams, maybe from, maybe I get my rights. Would you buy my food stamps and give me some money?
You can't do that anymore.
Something like that. That kind of thing might be going on.
Rebecca, you can't do that anymore. It doesn't work that way. SNAP does not work that way. You get a card, it has a set amount of money on it based on the application, and it's recharged there. You don't have stamps that you pull off, you can give to somebody else. None of that's accurate. So you need to tell people that.
But what if I give you my card?
I have an example in my family, so I'm not talking as the person you know, Rebecca. Okay. Yeah. You can what? Then you don't get the food stamps, do you? No, you do not get the money. So,
No, I have a question. I have a comment. The gentleman is talking about, I think he's really aware of what is taking place with food stamps for the people, because the card doesn't mean anything as far as getting other things that you need. You can use that card and go to the store with a person and get that money from that person to go ahead and pay your bills. Now, you don't have to, I don't know what he's referring to, but there's another thing I would like to say too. I haven't been here that long in Hickory. Now, I'm originally from Florida to North Carolina, but I lived in Philadelphia most of my life. And I've been here for about 5 years. And when I came back to live here, I was really surprised because of the poverty that is here among so many people. And I find one of the reasons is, during your election time, your voting time, especially our President Obama, a lot of people, I'm not saying everybody, look at his color and did not vote for him. They put their vote otherwise, but they're not reading, they're not listening, but people are trying to tell them, like right now, there are people working hard as they can like dogs for $7.50.
You're right.
$40 hours a week, and going home to nothing because of who President Obama is. They didn't want to vote for him. They voted for what they got in wrong. And you know what? They're suffering from it. They need to open their eyes and read and listen to people. And things would be better for them if they would only do what God tells them to do. Listen to what is for them, what is right. That man is there in the White House trying to do for everybody. Not only for blacks, but for everybody. But nobody sees it. And I'm surprised how poor it is in Hickory. It is ridiculous. I talk to people that are trying to get out in Hickory because they're so poor. And about a car, they need a car. Never had them with a car. These people standing on the street waiting on a bus. Sometimes they don't have a bus fare. You got to get from A to B if they have nothing but a hook to do it. But you need that car to try to get jobs, to try whatever they need to do. And it's just terrible here. And you know what? We need to really, people, you know what? I don't want to leave. I like it here. I really like it. And I don't mind trying to work and help these people mind. They need to open up and see what's happening to them. It's ridiculous. They need to see what's happening to them because of who is in the White House. That is the main thing that's happened today, what is in Washington, D.C. today is President Obama. And these people need to open their eyes and find out what that means to everybody.
That's right. Amen.
Are you going to respond?
Yes, I do.
Okay, then we'll come back.
Just briefly, I just want to say I get beat up every day, just like Reverend Ford does, about the deadbeats who got on the food stamps, driving a nice car. First of all, what's your definition of a nice car? A lot of people are so judgmental. If someone's not driving a beat-up hoopty with a duct tape on the back, over the back window, and if it looks halfway decent, they say, "Oh, that's too nice of a car." That's not right to judge people. What's a nice car? That's the first thing. The second thing is, you're right, Edith, and there's so many people in this area who crowd into one-bedroom apartments, two-bedroom apartments, 10 people living together all in the same place. Yes, they might have a large amount of food stamps for a larger number of people living in one place, driving one car where none of the tires are flat, where all the windows are not broken and go up and down. People are judgmental. What's a nice car? That's so wrong. Oh, don't get me started.
I just want to say too that besides food stamps, I mean, healthcare is sort of a much different policy concept than food stamps, and a lot of the benefits we talk about. Healthcare is very different. In fact, that was the cornerstone of the individual mandate that people buy insurance. The cornerstone of the Obama administration's argument was that healthcare is a completely different commodity. It's not like anything else. It's not like any benefit or other commodity. And there's a lot, and there are Nobel economists who have sort of first showed us how healthcare is different. And so really what we're talking about when it comes to healthcare is, I mean, we all are going to pay for healthcare. We're all going to pay for the people who died. We're all going to pay for the people who are sick and get care in the wrong place. It all has enormous consequences on our businesses, on our individual insurance costs, on our hospitals, on our healthcare system. The question is, really with health reform, is when are we going to pay for things? How are we going to pay for them? What type of care are we going to pay for? Not, are we going to pay for it at all? Because it's really about paying for things up front, making sure people can get care before things are beyond treatment, and making sure that we don't have all those costs shifted into the worst areas and shut down hospitals, increase insurance premiums, make businesses pay more, and all of that sort of notion. So healthcare, again, is a very different type of thing, and it's important that people, it's incredibly important that we have as much coverage as possible to make the most policy sense and to save money in the long term.
Keep it going.
All right, the only thing I wanted to say is that my grandson's in 7th grade, and it's about this car and everything else, but he comes home wondering, oh Mom, why does this young boy, why does he wear Nike shoes that might cost $200 when he gets a free lunch? And I try to explain to him that a lot of times we don't get acceptance because of something. We're not accepted in the group, and that is his way of trying to be accepted, and that's his family, trying to allow him to be accepted in the school system, because it is tough out there in the school system. It really is. And the other thing is, I also play tennis, USTA tennis. And we had this young lady who came, wanted to join and everything, and then she had food stamps. I don't know how it got out, but she was using food stamps. And somebody in our group said, well, how can she play tennis? And be on food stamps, because it does cost a little bit, not a lot, but a little bit. And I'm just, you mean because wrong with that?
We have 4 more hands, and then we're going to go ahead and wrap up with 1, 2, 3, and then this gentleman has the last word.
How you doing, colleague? I am one of the CCM patients, I'll say that. I lost a job because I asked too many questions. I couldn't find a job. All I've got is something part-time. I lost a car, I had 2. My really cool car was one that was taken. What I got now, while I was living, driving down the road. I'll get it fixed somewhere whenever I've got what I call a real job. I am one of those people signing for food stamps. I did not want to. I hate the thought of it. But it's either do that or starve. And they didn't cut, and they're going to be cut again. I don't think I'll ever vote Republican ever again. I'll tell you, the first time the Republicans got me was when I was in college about 100 years ago, and they cut the Pell Grants, and I went from getting grants. So my dad was on Social Security disability, getting no money, and I had to go to loans, which I paid off. I've had people in my church come up to me, "Hey, Drew, how you doing? You really want to know?" I tell them, and they're like, "Oh, hey, gotta go talk to this person over here. See you later, bye." People don't care how you do it. They really don't. They really, really don't. Because they don't look at you as being equal to them. They just don't. And you know, I say to those people, I wouldn't do this. Not being equal to me. I've had people tell me, you know, if you're doing so bad, why don't you get rid of your dogs? I got 3 chows. Be a cold day when I get rid of them. I don't have much in this world, but you're not taking my dogs. But thank you. Thank you, Colleen. You guys have got me on medications right now that if I didn't have my blood pressure medication, some days probably going to blow the top of my head off. So it's working, I'll say that.
Amen.
I'm just going to be short. This is a shout out to the Dr. Slice, Red Cross doctor who you came down that night to Claremont to rescue those people. I was sitting in that house when the top came off. I didn't know what had happened. Those people were less than less. They were dirt, but less than that. That night I was trying my best to help them. They didn't have nothing. God bless you for coming.
Amen.
Hey, I'm just struck by the amount of time we spent talking about false narratives about people, and frankly what I consider ridiculous stereotypes, instead of getting information out there. So let's think about that when we're engaging in those conversations. 12,000 women in North Carolina aren't going to get mammograms, right? So when we want to spend a lot of time with some of those people we're related to, who enrage us sometimes, let's include those facts because people don't know those numbers, and that's how we change those false narratives. So the other thing is, I live up in Buncombe County. 1 in 5 people has food scarcity in their home in Buncombe County. I don't know the numbers for Catawba, but it's probably similar. So when you include that message, are people going to debate a statistic with you that 1 in 5 people in Catawba County, or whatever the number is, don't have food in the home? What's the number for children? What's the reality of children who only get reliable meals at school? Let's talk about that. There's a lot of false narratives that certain cable TV shows promote, We can spend all day and 8 days a week debating that. Let's stick to the facts instead of getting driven into the corner, and that's where they want us to go.
That's right.
We've had a lot of good comments, a lot of good observations about our government programs and bad decisions that have been made. But when I hear these conversations and when I go out, what convicts me is the realization that in spite of the things that we see going on around us with bad elections, bad voting, bad choices by our politicians, and I know that the government can be part of the answer, but the answer is us, both in advocating for better decisions, voting more intelligently, advocating for change, but we've got to be obedient to God's call. And when we get in a situation of criticizing all the other folks, and rightly so, don't misunderstand, rightly so, don't forget to look inside. We can be just as easily judgmental and come to conclusions about people's motivations and all of those things, and sometimes we're right. Amen? Amen. But let's look inside and see if we're being obedient. I look around in Catawba County and I see no reason in the world that CCM should be struggling for money.
That's right.
I see no reason in the world why God's people can't be the real answer to all of these problems. That's what God calls us to do. That's what Jesus Christ has called us to do. So let's not ever hesitate to be advocates and work for change. But look in the mirror, folks. Look in the mirror.
I think that most of us in this room can agree that it's been determined that one of the major reasons of the agenda for the denial of the Medicaid expansion is because of political reasons. Because we really can't see any intelligent decision made otherwise. Another observation, and I'm wondering how we try to combat against this, and it actually goes back to the question that was asked that kind of got us off on a tangent about some of the other issues, some of the other programs, is that there are still too many of our residents and people that we serve in our churches that are not educated about the program, because if you were to ask someone about Obamacare and the negative stereotype views associated with that, and then you ask them about the Affordable Care Act, they are for one and against the other. When those of us who are educated about the policy issues understand that they're one and the same. So my question really, I guess I'm not sure who I should specifically ask it to, but how do we disassociate those things? Because if it is a political issue that is the agenda behind that, and if the issue was that many of the legislators and many of those who voted against the expansion in North Carolina saw it as kind of being joined together, it's juxtaposed together. You can't do the Medicaid expansion without people coming back and being retributionists when they go to the polls and saying that you voted to expand Obamacare. So what are we able to do within our communities to better help people to understand the difference and how to pull those things apart and understand what the benefits are going to be of Medicaid expansion without having to go with the negative stereotypes that are out there about Obama?
That is a great question. So I'll say first of all that the bright spot is that North Carolina has spread the word quite effectively about the Affordable Care Act because we're fifth right now in sign-ups for nationally for the number of people enrolling in health reform, in Affordable Care Act plans. After only California, Texas, New York, I think it's Texas, Florida, California, New York, so places with bigger uninsured populations. So North Carolina we're getting the word out about the Affordable Care Act, but breaking those two is important. Medicaid expansion is different than whether you want to implement the Affordable Care Act.
That's
or
right.
set up a state-based marketplace or any of those questions, which is why only a handful of states set up state-based marketplaces and fully embrace the Affordable Care Act. But 26 states, I think, have expanded Medicaid, and many of those are, Michigan, for example, most recently, has a Republican governor and a fully Republican legislature. So you have, Republicans embracing Medicaid expansion because they see the incredible financial benefits and also just all of the policy benefits of that. So I think we can use the words of these Republican governors, of Republican legislatures, and of the business people who have supported it. And in Ohio, for example, the pro-life organizations came together to support Medicaid expansion, even though they were opposed to the Affordable Care Act. So we really do have to dissociate the two. And there's options. The administration has been very flexible for states to expand Medicaid however they want. So that's another thing. And we can create a North Carolina Medicaid expansion option. In Arkansas, they said, we want to expand Medicaid using private insurance. So we want to use our Medicaid money and buy people private insurance plans. The federal government let them do that. So Arkansas is using that money and buying private insurance plans for low-income people. So again, it's sort of, we can do our own thing with it. We just have to accept the money and dissociate it from whether or not we support the Affordable Care Act overall.
We're going to go ahead and just go down the road and have our panelists give a final thought. Because we're going to try to end relatively on time. And so any final thoughts that you have? Adam, let's begin with you. We'll just go and then Dr. Simmons.
I'll just say quickly again that we can do, there are options for North Carolina, and that the decision is not final. For the first 3 years, the federal government will pay 100% of the cost, and it phases down to 95 and then 93, and then it's 90 forever. So the decision is never final, so we have to continue advocating on the issues.
Thank you so much for having us here, and I just want to kind of point out, we are here in the meantime, and please use your knowledge that you've learned here to pass the information on to anyone that you know needs help. I brought flyers here that I'll leave up here with our information if you need them. Folks like Dale are why we exist. If he didn't have his blood pressure medicine, he wouldn't be able to go to his job, and a couple hours means nothing. And hopefully, because we've helped him stay healthier, gives him a better shot to get a full-time job. And at the end of the day, that's why we're here, and that's what our goal is. And if North Carolina ever does expand Medicaid, we'll regroup and figure out where to go from there and where our needs are the most. But right now, with Medicaid not expanding and the Affordable Care Act in the position it is in North Carolina, and how many people are in that gap, we are here in the meantime. And I just thank you for having me here, and please feel free to contact me if you have any more questions.
I think better advocacy for the underinsured and those who are not insured. We need to keep that. And we need to support the clinics, CCN.
Yes, we do.
And those folks who are working behind the scenes tirelessly to help those who can't help themselves. And I think we need to do both.
Adam Winker, Colleen Anderson, and Dr. William Sims. Let's give them a round of applause. We appreciate your attention, and before we take our break, I know some of you may have to leave. We're going to please ask you there is an evaluation form that is underneath your agenda for today. You can even start filling it out now.